The Dean, Goa Medical College, Dr. Bandekar, the main person who has helped us actually conceptualize and take this forward, and why we are all here today, Dr. Kedar, Dr. Muriel, who both came together and decided that this is something that we need in the state of Goa, and that's the best way forward. Before going ahead, I would like to acknowledge the presence of Dr. Jayashree Farte, who Doctor just mentioned. Both the hearts are one, but the way you described it was really interesting. But yes, Madam, your presence here, our medical superintendents, Dr. Uday Kakurkar, Dr. Rajesh Patil, Dr. Madhu, and Dr. Ajit Nagarshekar, and all the other doctors, nurses, and the backup staff, and all the couples who are here today, who have come for registration. Today is a great moment for me because this thing started just through a thought process. And we, in the state of Goa, I would like all our brothers from the media and sisters from the media are here. All of us thought, discussed, and one thing we have learned from the Honorable Prime Minister is that if there is a will, there is a way. You have to have a vision, and that vision has to be implemented. There is no point having a conversation and having constant conversations and talks and trying to promise something which you are unable to deliver. Today I stand in front of all of you with the support of people who have tremendous amount of credibility in the state of Goa in the area of healthcare. I am very grateful to Dr. Kedar and Dr. Muriel for coming together and suggesting this to me, and that's the day when we took a decision that within 2-3 months that we will make sure that this thing happens. Then this center of assisted reproductive free treatment that we are going to give, this IVF center that we have now today we are commissioning, and we are going to start the first registration of the few couples. There are several inquiries, what I was told. A lot of people, not only from here, but from the peripheral other states also want to come and take this treatment. Our job is to see that we are able to not only replicate the success story, what Dr. Kedar has, but we would like this to be, I was just sharing with Dr. Kedar, is that we want to make this, there will be no compromise as far as the funding is concerned, whether it is funding from the government, but this is a center that has been put up by total CSR backup. This will be a total CSR driven center. There will be no shortfall. We want to make this center one of the top-notch centers in the country, and whatever financial assistance you want, that will be given to you, and we will see that this becomes a success story that is talked about all over the country. Today, I would like to make a mention to all of you. Many times in the area of healthcare, everybody talks of this so-called model called the Delhi model. I am saying this is a Goa model. And in the Goa model, we are trying to reach out to the people of the state, trying to provide services to the people and to the citizens to bring a smile on their face. I always say, and I said it last time also, whether it is a boy or a girl, no, it is the happiness that it brings in every house. That has to be our objective, and that is what we want to do. Whether it's a girl child or a boy child, both are competent in today's world. Both of them are capable of giving you the same joy, and both are competent of doing well in life, and that's how I feel that we need to have that type of a vision and move forward. Delhi model is a model that is only a hype model. Here in Goa, under the leadership of the Prime Minister and his vision and his thought process, we have been trying to do so much for the people and for the citizens. Goa is the only state. Globally also, Goa is the only state where IVF treatment is being given free of charge to the patients. Nowhere else in the country, no private hospital, no government hospital, nowhere this treatment is being given. And we want to see that the success rate of the center is going to be one of the highest, and we will ensure that whatever backup Dr. Muriel and Dr. Kedar want, we will make sure that we give those type of facilities and take this center to a different level. We want the success stories of this center coming out, and for that, whatever it takes from us to see that whatever you need, whatever setup you need, the staff that has been dedicated for this center will not be transferable. We'll try to ensure that we go on upgrading their knowledge, and we'll ensure that they get more and more exposure. We'll also ensure that they get that type of exposure that they become an asset to this wing and this center, and this is how we want to move forward. it's very easy many times, to conceptualize something. If doctor comes and meets me, we say, yes, we'll do it. But today it is we have not only discussed, we have also put it in action. It is here today, IVF center. We have also, doctor suggested certain things he requires. I have said that whatever the funding that is required will be made available, and we will make sure that this becomes a state-of-art hospital. Many times, a lot of things are given to us as we come to any function, and lots needs to be said, lots of pointers are given to us that what we should be speaking, but I generally don't read them. I don't read them because I'm totally involved with the team. Advice from Dr. Kedar, Dr. Bandekar, Dr. Muriel, and the other doctors who are here amongst us, trying to understand, and also from the younger doctors, trying to understand is what is our objective. Today, you also, after working in a center like this, will get that type of exposure you require when you go out of the center and work anywhere else also in the country or go out of the country. But here we are at a stage, and I would like to replicate, I don't want to replicate any model. I want to create Goa's own model. Today, what we do in Goa, our total focus today is interacting after this function with the couples that are come to register. I also understand there is a tremendous amount of confidentiality that has to be maintained. And also in addition to that, we have deliberately called our Mukhya Sevikas to pass on the message across the state of Goa as to what are the facilities that are there in Goa Medical College today. Today it's the Prime Minister, the different verticals through which we get money for the healthcare. It is Narendra Modi ji and his philosophy, his vision, which gives us more power, more encourages us and inspires us to see that we are on the delivery mode. And if we are on the delivery mode, then we will be able to provide more and more services to the people. I am very fortunate and happy to have been the Health Minister of the state for the last 12 years. We have been able to provide best quality care, best practices, and today we are also proud. Dean was with me. I will share at some other occasion as to what level we want to take healthcare. We are going to ensure the media is here, people are here, doctors are here, that in the next 6 to 8 months, you will see what is the transformation that is taking place in the area of health. We are not dependent on somebody telling us what we should do, but we are dependent on what needs to be done and advice on how we are able to save people's lives, how we are able to provide the best quality care to the people, how we are able to up our game in terms of saving lives and also giving the best quality different types of treatment. We have another department which is there, the Department of Robotic Surgery, which we want to do in the Goa Medical College, which was our vision. Today, standing here in front of you, I would like to tell all the couples who have come here with a lot of hope that you will go home smiling. You have the best of people here who are here to take care of you. Dr. Kedar, Dr. Muriel. And I have something in my mind. That comes from the inspiration of our leader, the Prime Minister of the country, is to see that we work differently. And let me tell you something. The hype that was created through media, not without any saying the media, but through the media, they're saying that the Delhi model, there is no Delhi model. The Delhi model is not a model that you need to be replicating. We are talking about a Goa model that will be replicating all over the country, and that is how we want to move forward. We are here delivering. We are here making things that were never accessible to somebody. People used to give up the hope that they want to have a child because they couldn't afford that type of treatment and that the cost of treatment was too high. Today, we have made that accessible and made that free of charge so that you can have that wish of having a child in your house has become a reality through the state government of Goa, and the vision of the Prime Minister to take it forward. I am happy and I would like to assure you that whatever we do, we are going to do it with all our heart. We are going to ensure that this doesn't run like a normal government hospital that should be running. These wings are going to be independent. These facilities are going to be independent. The staff is going to be dedicated. And this is how we want to take it forward. Goa model will be a model that is talked about all over the country. I am confident not only in the country but in different parts of the world of what we are actually doing. Concentration of research, and also we need to move ahead in that direction. But I am confident all of you, all doctors are going to be a part of this center under Dr. Muriel and Dr. Kedar. And we want to bring our own doctors who have been successful in the state and get them on board with Goa Medical College. We want to create this center at a level where even Dr. Kedar can say that I want to utilize more facilities of Goa Medical College, and that is the level at which we are talking. And we are very happy that we have associated with Dr. Kedar, Dr. Muriel. Both of them will make this a success story. And I'm looking forward to hearing the success story. I actually said we'll interact with though the confidentiality part is there, interact with the couples, give them the confidence that the state means business and the state wants to see that we are able to bring a smile on the faces of these couples who have come to this center and are registering themselves at this center with a lot of hope that they ultimately go home and they have this little baby that is a bundle of joy that gives them happiness. That is why we are all standing in front of you today. I would like to congratulate the team. I would like to congratulate the dean also. It's a united effort it is not easy when you want to do something at this level. But I am grateful to Dr. Kedar, Dr. Muriel, the dean and the whole team for helping us put this facility together. Like I said to the media, Goa model, wait for 6 months. Goa model will be the model that is talked about. There is no Delhi model. Delhi model is a model only which is hype model. It's the model that has not delivered on the lines of which the government of Goa has been delivering. Goa model is something that will be spoken about. Goa model is going to be a success story, not only here at the IVF center, but at the PHC level, CHC level. Yes, a lot of functional issues are there, but we will overcome all this and try to see that we provide the best of services across the state of Goa. The Goa model is something that we look forward to work with. You will see, I will give you a detailed presentation at some point of time during this course of the 6 months that where we were, where we are heading. And there are a lot of people who want to handhold us and take us forward. I would like to thank each one of you for coming here today and thank all of you for having put this together. We as ministers sometimes can bring and think about a policy, bring it together, but it is experts like you who can help us and handhold us as a government and take things forward. Money is available. Ultimately, you need a heart to donate, you need a heart to give, and I'm grateful the CSR, whatever needs to be given, we have been able to get the CSR. Ultimately, it's not about a name. It's not about whose name has to be there, who donated the money. It is the wish you had to bring a smile on the face of the couple. That is more important, and success story of the IVF center in the hospital is more important, and that's going to be our thrust, and that is the way we are going to move forward. I would like to thank the media for especially coming here today and all our doctors, teams, the couples who have come here for registration, our Mukhya Sevikas who are here to pass on this message across the state that we have a Goa model in place. This model needs to be replicated in other parts of the country. If there is a will, there is a way. All you need is the love for your people of the state in order to move forward and try to see that you provide the best care to the people. Things that were never accessible today are accessible. This is all what we want to do. What is not accessible to the poor man or a middle class family, make it accessible and make it accessible free of charge. This is the first. A lot of people ask me. I got calls from Delhi also to find out how is this running. This is totally CSR driven. It is totally driven. Our expertise, doctors like you, Dr. Kedar, Dr. Muriel are on board. Dr. Ajit is here. Dr. Madhu is here. Several other doctors who are here. Dr. Jayashri is here. This is how we want to move forward. This will be the vision of the government, and this is what I want to spell out to all the media, that when you talk to the people of the state of Goa, tell them we care about them, tell the people of the state that we are doing whatever we can to see that we save their lives, whether it is to cardiac, to the IVF center, to bring a smile on in every house, but our job is to see that we deliver. And this department is going to deliver at a different level, and you will be proud as members of the media, which are very important. आम्ही जे केल्या तुमच्या मनान कितें तुमी केन्नाय डॉक्टराक सांगू शकता. आमी हे तुमच्या खातीर केलां. म्हाका खबर आहा की प्रत्येक मनशाक प्रत्येक घरान आपलो एक भुरगो आसचो आनी एक वेगळे तरेची खुशी आसची, म्हणून ते आमी खुशी तुमच्या घरान येवची. गव्हर्मेंट इज देयर टू सर्व यू. the Prime Minister's wish is that outreach programs have to reach to the people, and what is not accessible to the people. लोकांक प्रधानमंत्री नरेंद्र मोदी जी यांचे विचारधारा की गरीब मनशाक जे श्रीमंताकूच एक्सेसिबल आसा ते आमचे साधारण आमचे व्यक्तीक रावंक जाय, आमचे फॅमिलीन खुशी येवंक जाय म्हणून तुमकां मेळपाक म्हणून हांवें सेपरेटली मेळपाक म्हणून बऱ्या भाशेन संपर्कान आसा
डॉक्टर को जगह दे रहा हूँ।
बसा बसा पण तुमकां सगळ्यांक
सर मातशी चेअर फुडें घे
ना सर तुमकां सगळ्यांक कितें दिसता की आमी जें केलां तें बरें केलां कितें तुमकां दिसता तुमकां कितें दिसता सरकारान बरें इनिशिएटीव घेतला म्हणून आनी तांकां तुमी केन्ना ठरयलें तुमी कोणी पयलें ठरयलें की आमी जेन्ना हे विशय फुडें हाडलो की केन्ना ठरयलें की तुमचे मदीं केन्ना चर्चा जाली की आमी वचून GMC तुमकां आमच्या संस्थेचेर विश्वास आसा आनी तुमी केन्ना ठरयलें
आमकां एक उमेद आशिल्ली जाल्यार की खंय तरी आमकां होप आसा की आमी फुडें आमचें डिसिजन घेतलें। सो जेन्ना आमकां एक्सपोज जालें की तेन्ना हांवें पयलीं कन्सल्टंट येवन पयलें की केन्ना स्टार्ट जाता केन्ना कितें जाता। सो तेन्नाच्यान आमी हें जायत आसलें की केन्ना आमकां हें मेळटलो चान्स मेळटलो की आमकां एप्लाय करपाक।
आनी तुमकां आमच्या संस्थेचेर विश्वास आहा गोवा मेडिकल कॉलेजाचेर आहा डॉक्टर केदाराचेर आहा डॉक्टर म्युरेलाचेर आहा तुमकां कितें दिसता की तुमकां भायल्यान तुमकां कितलेय गोश्टी येता पूण हे हांगा आयल्यार आयज तुमकां आनी कॉन्फिडन्स तुमचें वाडला की बाबा हे आमकां हांगा सक्सेसफुली आमची ट्रिटमेंट जातली सरकार लक्ष दवरतलें बरें बरें करून एंड ऑल द बेस्ट तुमकां डॉक्टर आसा सांगा तुमी डॉक्टर
परत परत मेन्शन कर की दिल्ली मॉडेल गोवा
बरोबर आसा कित्याक गोंया राज्यांत आमी पळयता तुमी मुद्दम कोण आमचे मिडियाचे भाव कोण जर दिल्ली गेला तुमी आयज पळया की गोवा मेडिकल कॉलेज आनी आमी जे तरेचे आमी नवे नवे गोश्टी करपाक गेल्या गोंया राज्य एकूच अशें राज्य आसा आनी आमचे देशाचे प्रधानमंत्री आनी ते जेन्नाच्यान प्रधानमंत्री जाले नरेंद्र मोदीजी त्यांच्या माध्यमांतल्यान वेगवेगळे व्हर्टिकलांतल्या माध्यमांतल्यान गोंया राज्यान आनी प्रत्येक राज्यान पयशे वेगळे तरेन येवंक लागले जे आमी तेजो उपयोग गरीब लोकांक आनी सामान्य जनतेक बऱ्यापैकी फॅसिलिटीज उपलब्ध आमी करून दिवंक शकता। ही इमारत जी आसा ते तेंच्याच खातीर ही आयज हांगा उबी जाल्ली आसा सुपर स्पेशालिटी ज्या तरेन सुपर स्पेशालिटी जावंक जाय ह्या फुडले 6 महिने ते 12 महिने भितर आमी जाय त्यो फॅसिलिटीज हांगा उपलब्ध करून आमी गोंयचे जनतेक वेगळे तरेची सोयी सुविधा आमी दितले। आमचे PHC पळयात आमचे डिस्ट्रिक्ट हॉस्पिटल पळयात आमचे डेफिशियन्सी थोडे आसूं येत पूण त्या दर्जेर पावपाक जे कितें पावलां आमी घेतल्या वेगवेगळ्या संस्थे कडेन हब एंड स्पोक मॉडेल पासून आयज IVF सेंटर हे एक स्वप्न आशिल्लें देशाने पयले हॉस्पिटल न्हू जगाने पयले हॉस्पिटल जे कोण फ्री दिता कोणूच फ्री दिना कदाचित खंय कडेन सबसिडायज करूं येत पूण आमी जे फ्री ट्रिटमेंट आमी पूर्णपणे CSR ड्रिवन हे सगळे आमी केल्ले आसा म्हणून हे आयज भारतीय जनता पक्षाचो सरकार आमचे गोंया राज्याचो मुख्यमंत्री डॉक्टर प्रमोद सावंत आनी देश जे चलयता आमचे देशाचे प्रधानमंत्री हे दिल्ली मॉडेल फक्त हायप मॉडेल दिल्ली मॉडेलान वचून पळया मुद्दम ते मोहल्ला क्लिनिक्स आनी तरेतरेचे गोश्टी ज्या गोंया राज्यान तुमी पळया गोंया राज्यान आमी तेजेर चड टिका न करता आमी आमच्या राज्यान गोवा मॉडेल आमी फॉलो करूंक जाय। गोंया राज्यान आमी कितें चल्लां आमचे कार्डियक फॅसिलिटी पळया आमचे आयज हे IVF ची फॅसिलिटी पळया तेजे भायर आमी रोबोटिक सर्जरीची आमी मार्गार हाडपाचे प्लस PHC CHC कशें लिंक अप करपाचे हे सगळे गोश्टी तुमकां टायम टू टायम येतले। ऑलरेडी प्रोसेस ऑफ डिस्कशन फायनल स्टेजीर पावले आसा। आतांच डॉक्टर अमित महादेव बी हांगा येतले तेंचे बी आमी आतां टायअप करून एक गॅस्ट्रोएंटरोलॉजी एक इन्स्टिट्यूट आमी एक सेटअप करपाचे ऑलरेडी डिसिजन जाला हे आमी 19 डिसेंबर आमचो टार्गेट आसा। IVF सेंटर हे सक्सेस स्टोरी जातली हे देशान न्हू जगभरान उलयतले की गोवा मेडिकल कॉलेज एक गव्हर्मेंट हॉस्पिटलान आमचे बऱ्यापैकी डॉक्टर जे आसा डॉक्टर म्युरेल आहा तेंची डॉक्टर अजीत आहा पुराय टीम डॉक्टर मधू आहा डॉक्टर केदार जे आमच्या तेंच्या खातीर आयज आमी ह्या स्टेजीर पावले तांकां मुद्दम हांवें सांगलेलें आसा की पयशाची कसलीच कमी जावची ना गोंयचे जनतेक कितें बरें आमी करूं शकता सामान्य जनतेचे खातीर तेजे जिवनान कशें आमी वेगळे तरेन आमी परिवर्तन करूं शकता हेज्या खातीर आमी सरकार चलयता। आउटरीच प्रोग्राम आमचे आनी स्ट्रेंथन करपाचें काम आमी ऑलरेडी डिसिजन घेतलेलें आसा की हब एंड स्पोक मॉडेल आमी कशें वयतले। आमी मुद्दम डॉक्टर केदाराक सांगलां की जे कितें तुमकां करपाक जाय की हे सेंटराक एक टॉप क्लास सेंटर देशान करपाक ते सगळे फायनान्शियल असिस्टन्स तांकां गावतले आनी ह्याच तरेन आमकां फुडें वचूंक जाय। राज्यान जर पळयल्यार तुमी गोंयान रावता म्हणून तुमकां कळना पूण दिल्ली जर वचून पळयल्यार पयलीं सगळे मिडियान म्हणटाले की दिल्ली मॉडेल कसलें दिल्ली मॉडेल आनी कितें तें दिल्ली मॉडेल तें म्हाकाच कळोंक ना आयज पर्यंत. आयज गोंया राज्यांत जेन्ना आमी सगळे फ्री दिता पेशंटाक इन पेशंट आउट पेशंट मेडिसिन पासून आयज कोलेस्ट्रॉल रिडक्शन मेडिसिन पासून लायफ सेविंग केमोथेरपी पासून आयज आमी डिसिजन आमी घेतला की आमी आतां ह्या हॉस्पिटलान आनी आमी डॉक्टर्स रिक्रूट करपाचे आमी चालू केल्ले आसा ऑन्कॉलॉजीन आनी त्याच बरोबर आमी आयज हॉर्मोनल थेरपी आसूं काय टार्गेटेड थेरपी आसूं काय हे आमचे इम्युनोसेल्युलर थेरपी आसूं ते सिलेक्टिव्ह मेथडॉलॉजी वापरून ते सिलेक्टिव्हली पेशंटाक दिवपाचो आमी फ्री दिवपाचे आमी ठरयल्ले आसा आनी हे आमी करतले. डॉक्टराक ऑलरेडी सांगला की चालू करा म्हणून, कारण आयज मनशाक कॅन्सर जर जालो तेका तेजें जीवन वाचोवपाक वेगळ्या तरेन विचारधारा असल्यारूच आमी त्या मनशाक योग्य तरेचे ट्रिटमेंट आमी दिवंक शकता. जे तेका परवडना ते ट्रिटमेंट आमी ह्या राज्यान आमी दितले. आयज DDSSY हे सगळे आमी हेजे वेगळे तरेचे चेंजीस हाडपाचो आमी प्रयत्न आमचो चालू आहा. म्हणजे प्रायव्हेट हॉस्पिटलाक बी तेजो फायदो जातलो आनी गव्हर्मेंट हॉस्पिटल एक स्टेट ऑफ आर्ट फेसिलिटी करपाचो आयज उद्देश आमचो आसतलो. IVF सेंटर हे सेंटर सक्सेसफूल जातले. आमचे कडेन आमचे डॉक्टर केदार आसा, आयज डॉक्टर म्युरियल आसा. डॉक्टर केदार आमकां हँड होल्ड करतले आनी तांकां जें कितें जाय गोंया राज्यान लोक आयज म्हणूंक जाय देशान की बाबा हो सरकार जो आहा हो गोवा मॉडेल आमकां इम्प्लिमेंट करपाची गरज आहा. आयज दिल्लीच्यान बी आमकां फोन येता, भायल्यान फोन येता की बाबा तुमी कशें करता म्हणजे इच्छा शक्ती असल्यार आमी करता. आयज जाय ते कडेन लोकां कडेन पयसो आसता पूण दानत आसूंक जाय लोकां खातीर खर्च करपाक, ते ना ते दुसरे कडेन. ते दिल्ली मॉडेल करून बेश्टे हांवें जायरात घातली म्हणून जायना. गोवा मॉडेल नरेंद्र मोदीजीचो मॉडेल आनी जे तेणी आमकां इच्छा शक्ती तेणी निर्माण आमचे मदीं केल्ले आसा. आमी तेंचे कडेन इन्स्पिरेशन घेवन आमचे डॉक्टरची टीम इतली बरी आहा हे डॉक्टरांक फुडें व्हरून तांकां जे कितें सोयी सुविधा जाय ह्यो सक्सेस रेट वाडोवपाक हे करपाक आमी प्रयत्नशील आसा.
तुम्ही पळयतात गोवा न्यूज हब.